I am doing this with Periscope too, so I'd be looking back and forth a little bit. So my name, for those of you who don't know me, my name is Christina. I am your Dr. Oily Mom. I am the mother of two beautiful children. I am a physician who believes in preventative medicine, health and wellness, and I am board certified in emergency medicine. I've been practicing medicine for about 20 years. And we're going to talk a little bit today about vitamin D with kids and in pregnancy. So for those of you on Periscope who have not been to my Facebook page, I do a lot of education there. And it's Facebook.com/Dr.OilyMom. So it's pretty easy to find me. Or you could just Google Dr. Oily Mom. It's pretty easy to find me. So check out my Facebook page, like me there. And let's get started, guys. So the other day we talked a little bit about vitamin D for general adult population. And I got a lot of questions after that about what do we do with kids? How are you addressing it with your kids? How are you, and what about in pregnancy? So let's talk about that. So it was pretty interesting. The number of children in the last 5 years who have developed vitamin D deficiency has increased over 200% just in the last 5 years. So why is that? Part of that is probably because we're not supplementing enough and that we're not getting enough sunshine. A lot of people have become so fearful of getting in the sunshine for fear of skin cancer that we're overdoing it with sunscreens, and a lot of these sunscreens too have chemicals in them that can cause cancer. So we're sort of coming at it from a bunch of different directions. So the best way to go about that is to, and we talked about this the other day, is to make sure that you get your sun exposure when it's warm enough. And of course, the months November through March, especially where I live, are the lowest in vitamin D producing UVB rays from the sun. And even in states like Florida, those states, you still have a lower UVB rate there during those months. So you have to get a little bit more sun exposure without sunscreen on. You can't get vitamin D development through your skin if you have sunscreen on. So, and you need that time frame, the best time to get sunshine. And we covered this the other day, but I just kind of want to review that. The best time to get sunshine in order to get enough UVB to use that sunshine to create vitamin D in your body, which is what your skin does, is during the middle of the day. So that's the other thing. We've all been counseled, don't stay out in the sun in the middle of the day. Go in the morning, go in the evening, but don't be in the sun in the middle of the day, and make sure you have all the sunscreen on or you're going to get cancer. And and then I did mention also the sunscreens that we're using, quite a few of them over-the-counter things that you buy at whatever drugstore. A lot of them have chemicals in them. So it's very important also to note what type of sunscreens you're using. There are some natural sunscreens that you can create on your own, actually. Using zinc oxide is one of my favorite things to use. In addition, you can create that with some coconut oil and some essential oils, and it'll be a nice smelling mix that will protect your skin from the sun. So when we can go into a recipe later, but for now, just suffice it to say that chemical-filled sunscreens are not a good option. You're better off just wearing a hat and a long sleeve clothes when you're out in the sun once you've gotten your vitamin D. But anyway, I don't want to get too far into that. So what are the requirements for kids and adults? We talked about the last time that about 35 IU of D3, which is the more bioavailable form of vitamin D, D3 is what, per pound of body weight, is what you need a day to meet your body's needs. And that is totaling what not only you're eating through your diet, what you're getting through your sun exposure, but then also your supplementation. So during the summer months, if you're getting enough UVB exposure, you don't have to supplement quite as much, and especially if you're eating a healthy diet full of fatty fishes and pastured eggs and things like that. That will increase your vitamin D levels. So you kind of have to be aware of where you're starting. So having your vitamin D levels tested are a great way to start, kind of figure out where you're at to begin with, and then how much supplementation you need in order to get your body where it needs to be. And I didn't mention this time, so I want to make sure I mention this. So your goal is about, and the literature is all over the map, less than 20 vitamin D level is too low. That's considered critically low. However, there's some people say you need a level of 30, some people say 70. From most of the literature, kind of gathering together most of the literature, it is my belief that a level of 50 to 70, somewhere between 50 and 70 nanograms per milliliter of vitamin D in your bloodstream is probably where you want to aim at. And so for kids, I was asked the question, well, what do you do as far as your vitamin supplements for kids? And actually what I use is Young Living's Mighty Vites, now that they're back in stock. And I love these because they offer quite a lot of wonderful things. However, I was a little disappointed to find out that there's no K2 in these, and they just reformulated them. So I'm going to have to write a little letter to product support and ask them why we didn't add K2 while we were reformulating. But that's besides the point. So this is what I'm using at home. It does have vitamin D3 in it, as 100 IUs in it, in 3 tablets. So you'd have to take 3 tablets to get 100 IUs. So for small children, these are chewables. This is probably pretty good. Depends on the child's weight, right? So you want to kind of calculate it based on their weight, and you want to get a baseline level the next time your doctor draws blood work. I mean, I wouldn't necessarily rush out and get a special blood draw and torture your children, but if they happen to be getting their blood drawn at the next doctor's visit, well visit, whatever, then I would probably ask your doctor to add that and kind of get an idea where you're at starting. And then you can get an idea how to go from there. So you would just add this up. And I mentioned last time, and oh, you know what, I'm going to jump off screen for half a second just so I can grab it and show you. Hang on one second. But this company is called Thorne, Thorne. And of course it's always backwards on the screen when I show you guys, but this is the company. It's called Thorne, and it's vitamin D K2. So you want to make sure that you're getting K2 along with your vitamin D. K2 is what makes sure to push the vitamin D towards making calcium go into the bones themselves. So because you want vitamin D to calcify your bones. You don't want it to calcify your arteries and your kidneys and cause kidney stones and heart attacks, and you don't want it to calcify your brain and the arteries in your brain and cause stroke. So K2 is really important, and we talked about that. Go back to my video from about 5 days ago, and you guys can learn more about that. But it's important if you're supplementing with these drops, and especially if you're using Mighty Vites, if you're a Young Living person and you love the Young Living products, but you want to make sure your kid is getting enough K2, and it is important to make sure they get that, then I would add drops of this to water or juice or their breakfast cereal. I mean, whatever, just drop it right on top of whatever they're eating and let them ingest it. And again, you'll have to calculate based on their body weight kind of where your goal is at. And if their blood level that comes back from the doctor is lower than 50 to 70, right, nanograms per milliliter, then you're going to want to give a little bit more until you get it to the level where you want it to be. And then you can kind of go back to a maintenance dose. And you can talk to your doctor about what you're using at home and have your family doctor support you and help you figure out how much you should be giving per day until you can get your child's level where we want it to be. It's really important. In pregnancy, I was really surprised by the statistics. But the more I thought about the physiology, the more it made sense. Pregnancy is actually a lot of the decline in the vitamin D levels in children, the increase in the vitamin D deficiency, I think can be related. There's some studies out there that are suggesting it is in fact related to the fact that pregnant moms are not getting enough vitamin D. And because they're not getting enough vitamin D, baby's not getting enough vitamin D in the womb, during development in the womb. And that's super important. It has to start from the very beginning. So if you are pregnant and you are supplementing, you need to make sure that find out what your level is today and start supplementing till you can get your levels up to 50 to 70. You want to make sure you're on the high level of that if you can, because you're essentially providing vitamin D and K2 for your growing baby. So you're doing that for two people, for yourself and for your baby. So, other things to consider when you're talking about pregnancy is, because my little formula, the 35 IUs of D3 per day per pound of body weight. So if you think about pregnancy in the very first trimester, right, you don't, well, I always gained a lot of weight, but not everybody does. But you're not gaining a ton of weight in the beginning. You gain some. But as you're gaining weight during your pregnancy, you need to increase your supplementation and your sun exposure if you can, in order to compensate for your body weight, because it is actually delivered to baby based on body weight. And as baby gets bigger, you'll weigh more, and you will get bigger. Sort of one of the things that happens during pregnancy, whether we like it or not. And so you need to compensate for that. So you need to keep a close eye on it. Talk to your OBGYN about it, or your doula, or whoever is taking care of you during pregnancy, and come up with a plan on how you're going to supplement. The supplements that I mentioned for adults the other day, Master Formula, MindWise, the Thorn that I just showed you, and Omega Gies are the ones that I like to use, that I support 100%. They're wonderful formulations. They can be added up to kind of try and figure out where you're at. So the other thing that's important to consider is with pregnancy is, if you're carrying during winter months, you want to be, just the same as if you're carrying during summer months, it's easier to get more vitamin D just by being outside. But if you're carrying in winter months, you really need to keep a close eye on your vitamin D levels, closer eye on it. And because it's a 10-month process, we're rarely in one single season, right? Pregnancy crosses at least 2 seasons for most women, obviously. And so that's what you need to think about. And again, talk to your doctor about it. Go through if you're taking prenatal vitamins. I went through about 6 or 7 different prenatal vitamins, both at Whole Foods and on Amazon today, looking at what's actually in them. And they ranged from anywhere from 400 IUs of D2, which is not a very bioavailable form of vitamin D, to 2,000 IUs of D3. Some of them had K2 in them, some of them did not. Some of them had a mix of K2 with K1, both good vitamins, but if you don't have enough of the K2, or your vitamin doesn't tell you exactly how much, that they lump it all into vitamin K and they say some of it's K1 and some of it's K2, but they don't tell you which I was kind of surprised. There were several of them like that. Then you don't really know how much K2 you're getting. K1 and K2 are totally different. They're totally different things. So you need to know how much K2 you're getting, or another way of putting that is MK7 is the other abbreviation for that same vitamin. So you want to make sure that you have that information. And you want to, the other thing that I don't like, and I couldn't find a single prenatal that didn't have folate still. They all have folate instead of folic acid, which drives me crazy because folate is not very bioavailable. And the whole point is to give a baby enough folate for development and the high rate of cell turnover during pregnancy. But a lot of the prenatal vitamins don't have folate. They don't have folic acid, which is really the more bioavailable form. And that has nothing to do with vitamin D. I'm just throwing it out there because I'm endlessly annoyed with the vitamin industry not fixing that. So, hoping for better prenatals to come out. I did see some things that were much better than when I was pregnant with my last pregnancy, which is, 7.5 years ago now. So they are improving, but there's still some room to go to catch up with the current research. So don't be afraid to not take a prenatal vitamin, but to use other vitamins with a company like Young Living and put things together. Piece some things together to get all the nutrients that you need in a different form. That's okay to do. That's okay. You want to take Master Formula, MindWise, Omega Gies, and a couple of other vitamin C. If you want to do it that way, maybe it's taking a little bit more than what you want, but you can get a better formulation of the things that you want. And that may be a thing that you want to do. So if you do, try that. Go through, just take all of these, the information, the ingredients from these things into your OB's office and say, hey, how much of what do I need? And figure it out with them. Ask them for their help. That's what they're there for. So don't be afraid to ask the question. All right. I hope that helps answer some of the questions. I sort of got a ton of inbox messages after the last one. So I wanted to answer the question as far as kids and pregnancy. And then the amounts for kids in pregnancy are really not any different. Vitamin D3 and vitamin K2 are super important in all stages of life. From the time you're conceived to the time you die, you need to have it in order to stay healthy. Vitamin D3 has been, lower levels in pregnancy has been related to preeclampsia, so that's something that's important to note. And vitamin D deficiency and they're doing a lot of research right now, but there is some indication that it may lead to increased incidence of multiple sclerosis in the baby's life as the baby grows older, becomes an adult. Increased autoimmune disorders like rheumatoid arthritis and Crohn's disease, increased incidence of things like type 1 diabetes and rickets, obviously, because that's the definition of rickets. Also, dental health can be affected by low vitamin D levels in pregnancy. And there's a recent study, too, that suggests that there may be increased incidence of asthma in babies that are born vitamin D deficient. So some things to keep in mind and just to kind of follow and make sure that you're checking and supplementing and doing what you need to do. So I hope that answers some questions. I hope you guys have a wonderful day. I will be doing a part 3 on this. We're going to talk about magnesium as I promised, but I am still doing a little bit of research because I want to provide you with some information on the best supplements to use. So I'm going to try and do that in the next couple of days for you. And in the meantime, I hope you guys have a great time, have a great day, and I'll talk to you guys soon. Bye.